So Matt, you want to go ahead and get us started?
Yes, and thank you so much. Good afternoon, and welcome to the 2050 Rural and Human Service Transportation Plans Regional Workshop, focusing on the Southwest Georgia region. My name is Matthew Wilson. I serve as the Mobility Manager for the Georgia Department of Transportation and as the project manager for this plan. And I want to thank you all for attending this afternoon. Just a few virtual meeting housekeeping items. First, we ask that you please keep your mic on mute during the presentation. This ensures that everyone is able to hear the presentation clearly. For those using a computer or smartphone, this is the microphone icon with a slash through it. For those on the phone, we ask that you please mute your phone. As we progress through the presentation, we have scheduled breaks for questions and discussion. Please ask or provide a comment. This workshop is designed for us to better understand rural and human service transportation in your area, and your active participation is encouraged. When asking a question or making a comment during these times, please use the raised hand feature in Teams. This is the icon with the smiley face and hand. Alternatively, you can use the chat box feature to type in your question, which is the comment bubble icon. Our team member Jaquita will be monitoring the hand raises and chat box during the entire workshop. If you're on a phone calling in, you'll be unable to raise your hand or use the chat box. So during the discussion segments, we will ask if anyone on the phone would like to speak. Please unmute your phone and begin speaking. The 2050 Rural and Human Services Transportation Plan is a 3-agency plan. I will speak more about this in the coming slides. The Georgia Departments of Transportation, Human Services, and Community Health are the plan sponsors. The plan is being developed with the help of a consultant team comprised of AECOM, Cambridge Systematics, and Modern Mobility Partners. Today, we're going to run through the following topics. I will provide a brief introduction and some background on rural and human service transportation in Georgia. I will then hand it off to Will Brewer from AECOM to review the available transit and transportation services in the Southwest Georgia region. After, Baird Breen from Cambridge Systematics will walk us through the region's transit needs. And then Kirsten Moat from Modern Mobility Partners will guide our discussion session. We will also have a couple question and discussion points throughout the workshop today. So what exactly is rural and human service transportation? Not many people may be familiar with the terms. Rural and Human Service Transportation, or RHST, are mobility services designed for the benefit of disadvantaged populations, including persons with disabilities, older adults, and persons without a vehicle. RHST includes services provided by public transit operators, human service agencies, private providers, and private nonprofit agencies. This 2050 RHST plan seeks to do a few things. First, we're going to update the existing conditions information from the previous plan. Then we're going to build upon the recommendations and efforts completed from the first plan to identify projects, programs, and policies to meet current and future demands and provide enhancements to RHST services across Georgia. I mentioned that this plan is a 3-agency plan. This is because the state of Georgia administers 3 systems to provide public transit, human services transportation, and non-emergency medical transportation, or NEMT. Each system is administered by a different state agency using different funding sources. GDOT focuses on public transit for rural and small urban populations. DHS focuses on transportation services for seniors, low-income families, individuals with disabilities, and vocational training, while DCH focuses on transportation to medically necessary services for eligible Medicaid members. Coordination exists at the state, regional, and local levels. However, each agency's system operates independently, using a variety of service delivery models with differing requirements. The state's role in governing transit is primarily to oversee compliance with federal grant requirements. There is no single state authority to set priorities for public transit and human service transportation, or to coordinate planning and funding of transit services for rural communities. A little bit of history on the RHST plan. Back in 2007, the Georgia Departments of Human Services and Transportation completed the Coordinated Public Transit Human Services Transportation Plan. As an update to the plan, GDOT initiated the Georgia Rural and Human Services Transportation Plan 2.0 in 2011. This RHST Plan 2.0 outlined coordination activities among the rural public and human services transportation providers across the state to achieve improved service delivery for the state's public transportation and human services transportation customers. plan also developed recommendations to implement mobility management at the state and regional level. In 2021, GDOT, DHS, and DCH began developing an update, the 2050 Georgia RHST plan. The purpose of this plan is to provide a framework for additional coordination among Georgia's agencies impacted by mobility services and continue the work of the Technical Coordinating Group, which is now renamed the Technical Advisory Group, and expand its participation to additional stakeholders. A quick look at our plan schedule. You can see we've wrapped up our vision and goals, which I will discuss on the next slide, and are heading into our existing conditions and needs assessment and beginning our alternatives analysis. What I want to focus on today is how to get people involved in this process and how we can get input from your region to help us understand needs and develop solutions. The stars on the schedule indicate stakeholder and public outreach events. Those with a pink circle indicate the technical advisory group meetings. Outreach is a key component of the RHST plan update and ensures the agencies updating the plan fully understand the rural and human service transportation needs across the state. The Technical Advisory Group, which includes the 3 state agencies sponsoring the plan, also includes representatives from the regional commissions, the statewide Independent Living Council of Georgia, and other stakeholders identified during our stakeholder engagement process. We are engaging stakeholders and the public in each of the 12 regions in Georgia through these regional workshops. And again, thank you so much for attending today. We are also conducting a statewide survey for RHST providers and a separate survey for riders, the link to which is on the QR code on the slide. These efforts will provide all Georgians an opportunity to assess the status of the RHST plan update and identify key needs and service coordination strategies. Additionally, public feedback will be elicited during the 30-day public review and comment period for the draft RHST plan update, which we're targeting for July. The RHST vision and goals are structured from the statewide transit plan. Our vision statement outlines where we would like rural and human service transportation to be in 2050, which is to continue and grow statewide rural and human service transportation coordination to improve the quality of life and economic activities of all Georgians, specifically those in rural areas, those with disabilities, older adults, and persons without vehicles. Our 6 goals, again based on the statewide transit plan, outline how we seek to implement the vision. The first goal is to provide coordinated and efficient rural and human services transportation. The second is to provide a safe and sustainable RHST network. The third is to optimize public transit programs to best meet public transit systems and travelers' needs. The fourth is to ensure public transit coverage across the state to support mobility and access for all. The fifth is to connect rural transit to regional and urban centers. And finally, the sixth is to leverage technology and innovation to support public transit ridership and performance. I would now like to hand it over to Will Brewer from AECOM to walk us through the available transit in the Southwest Georgia region. Will?
Great, and thank you so much, Matt. Thank you everyone for joining us. As Matt mentioned, my name is Will Brewer, and I will be taking you through a brief snapshot of your existing transit systems and transit services throughout the Southwest region. You have a rather, I'd say, unique system. So I'll start with Albany Transit. There is an urban system that services the city of Albany with 12 fixed routes and paratransit. And then there's also a county-wide transit system for Thomas County, demand response rural. Southwest Georgia Regional Transit does provide services for the following counties: Baker, Colquitt, Decatur, Dougherty, Early, Grady, Lee, Miller, Mitchell. And also it does provide services to cities of Arlington, Dawson, and Sylvester. So as I walk through the other 2 maps, just want to give you a brief idea of human services, transit services, and non-emergency medical. As you can see on the map, every county is well represented with DHS services, and those parties that are involved would be Division of Aging, Division of Family and Children Services, Department of Behavioral Health and Developmental Disabilities. And so for those of you on the call who cannot see the map, all counties are represented by those 3 organizations that I just mentioned. For non-emergency medical through DCH, there are 2 brokers that operate across the state in 5 different regions, and Southwest happens to fall within the Southwest region, and that broker would be Motive Care. And so that is where all your DCH services will be provided. Kirsten, I'm going to hand it to you in a moment, and she's going to kind of go through these maps again, and we're going to talk about if we're missing anything and if there's anything else that you'd like to provide. So Kirsten, I'll hand it to you.
All right, thanks, Will. Yeah, so this is kind of one of those first scheduled breaks where we want to hear some feedback from you all. We've got a polling exercise. So for those of you who have a computer or smartphone handy and want to join the polling, you can join us at www.menti.com. That's MENTI.com. Or you can scan the QR code that is on your screen. It'll prompt you to enter an 8-digit code. The 8-digit code is 12290533. And that code will remain at the top of the screen during the questions for your reference. If you do not have a smartphone or a computer, or just say, I don't want to deal with that, that's fine. I'm going to ask the questions verbally. If you have a response and you're joining us through the Teams application, you can raise your hand or put your comment or question in the comment box. If you are on the phone, please feel free to unmute yourself and respond to the question. So let's get started. First question. So based on the maps that Will went through, and I'm going to go back in a minute so you can have them on your screen, and I'll kind of talk through them some more for those that are on the phone. What are we missing? What do we have incorrect on these maps? Are there transportation services that are provided that we are not showing? Are there areas where we're showing transportation services provided that there are not any of those services provided? And then what other services are we missing? Are there faith-based organizations that maybe are operating a transportation service for a specific group of people, but they don't fall under one of these categories? They're not doing that service through Department of Human Services or Department of Community Health or Georgia Department of Transportation. Maybe they're just doing it on their own. Those types of operations would be helpful to know as well. So I'm going to give it a minute, let you think. I've got the maps back up on the screen. So as Will mentioned, Southwest Georgia Regional Transit does have a coordinated system, and they provide service across the majority of the Southeast region, with the exception of the city of Albany and Thomas County. They also cover the cities of Sylvester, Dawson, and Arlington under the counties of Calhoun, Carroll, and Worth. As far as human services, there are aging, Department of Family and Children's Services, and Department of Behavioral Health and Developmental Disability Transportation Services. That's a mouthful. Across the entire Southwest region. So we're not showing any gaps as far as geography in human services transportation, and same with non-emergency medical. You have a third-party operator, Motive Care, who handles all, or a third-party broker who handles all of the non-emergency medical transportation, and it's all within the Southwest region. So I'm going to go back, see what kind of responses we have. So one of them is unknown. Another one is employment transportation, like a fixed option specific for employment transportation. And I think that's a great comment. That is something that we've heard in other regions, is that while the 5311 or public transit can provide transportation for employment or for workforce, they feel there needs to be a separate program that is specific for workforce transportation, whether it is partnering with specific employers in the area, or it's a program to support apprenticeships and technical colleges, especially younger populations like 16 to 18 years old to help get them to internships, apprenticeships, getting them into the workforce, getting them prepared. Somebody asked, are these maps located on your website? Yes, on the GDOT website, under transit, so www.dot.ga.gov/transit. You will find a Rural and Human Services Transit icon or picture, and there is a fact sheet that has all of these maps for the entire state. In addition to that, this presentation and a recording of this workshop will be made available on the GDOT website at the end of the week. So you will have access to all of the slides that are up here today. Okay, so what transportation services are missing? Demand response trips for the elderly that cannot get to a bus stop in urban areas. It's available for rural areas, but those urban areas like the city of Albany do not provide demand response. They only provide fixed route transit. And I think that's a great comment. Something that we've heard in other regions. And some of the things that we've discussed is like adding flexibility to those fixed route services. So making them more of a flex route service, where if they do have a request for demand response that is off the route, that driver has the flexibility to go off route, make that pickup at that demand response location, and then get back on the route. Other solutions may include something like microtransit, which can still be in an urban area, but it's one service or one or two vehicles that are operating on an on-demand basis rather than fixed route. So great comment. Keep them coming. I'm going to move on to the next question. That does not mean you have to stop entering responses, comments, or questions in the chat box or raising your hand. The next question. So thinking about the existing transportation services that are out there today in Southwest Georgia, what are some of the constraints or obstacles or challenges you are facing on a daily basis? So some examples of these may be you want to operate more days of the week, like maybe you don't have service over the weekends, or maybe you want to be able to operate more times of the day. We've heard in other parts of the state that being able to provide transportation services in the overnight hours or at least later into the evening would provide service to those third shift employees, especially in areas with high industrial, manufacturing, distribution, and warehousing. And that's something that has been a constraint and they would like to find a solution to. Other constraints may be labor shortages. We're going to talk more about that when we get to some of the survey responses we've heard so far. Driver shortages, funding shortages. I think that's always a constraint and an obstacle people are dealing with. We do have one comment wanting extended days of service. So trying to fill that gap by extending your days and maybe your hours. What are some other constraints that you have? What keeps you up at night? Maybe you're dreaming about NTD reporting. Public trips on weekends for shopping, etc. So going back to extending the days of service for your 5311 service. Maybe it needs to operate more than, 8 a.m. to 5 p.m. or 8 a.m. to 6 p.m. during Monday through Friday. Maybe if you could provide service on the weekends, you'd provide people who maybe don't have a car or choose not to drive to be able to make some trips during the weekends. That's great. I think this region, y'all have been very successful in your coordinated system, and I'm going to have some questions for you about that specifically. But maybe there are still some constraints that you're dealing with. And I think especially, we heard this from the River Valley region more so than any of the other regions is that they're really dealing with a lot of trips coming from Alabama. With y'all being in the southwest corner of the state, maybe there's some challenges or some obstacles associated with trips in southeast Alabama or northern Florida. Another constraint, staff shortages and limited buses, number of vehicles, new vehicles. Certain times of day, vehicles are full with DHS clients and they're not as accessible for the public. I think we've heard that for a long time, not just in this study, but I remember that being one of the concerns back when the 2.0 plan that Matt mentioned back in 2011 was done. Okay, we'll keep them coming through the chat box, through the raise hand feature. The polling exercise is over, so we're done with the Mentimeter. You can close out of it. We're going to have a couple more. We're going to have one more break in the presentation, and then at the end of the presentation, we're going to open it up for more questions and comments. So keep them coming. This is really helpful, and thank you. So I'm going to turn it over to Mr. Baird Bream with Cambridge Systematics. He's going to talk to you about the needs assessment that he and his team have been working on that kind of gives us some indication of some of the demand in this area.
All right. Thank you very much, Kirsten. Good afternoon, everyone. Looking forward to sharing our preliminary findings from our quantitative and qualitative elements of the needs assessment with you today. So to start, this needs assessment methodology is based on the needs assessment methodology that GDOT used for its statewide transit plan in 2019 and 2020. We maintained this consistency in order to have a kind of clear comparison between the two planning documents, see what has changed, see if there are any new kind of lessons learned that we can take away. And additionally, both of these methodologies are based on a recommendation and guidance from the Transit Cooperative Research Program, which is a national research center that essentially defined this methodology as a recommended approach to measuring transit demand specifically in rural areas. So we know that this methodology is, pretty robust, pretty reliable. It's been rolled out around the country, so we know it kind of stands up to scrutiny. So with that, we'll move to the next slide and present kind of the two main ways in which we conduct this methodology. The first is a non-program demand assessment, which is highlighted in blue in this table, and a mobility gap demand assessment, which is highlighted in green in this table. Both of these approaches allow us to calculate the estimated rural transit trip demand throughout the region, essentially estimating demand at every county level and aggregating that into a regional analysis. Both the non-program demand assessment and mobility gap demand assessment approaches draw on demographic data among transit-dependent or transit-reliant populations within the region, again, taken from a county level and aggregated to a regional level. The non-program demand assessment focuses on three different transit-dependent and transit-reliant populations, people ages 60 and older, people with disabilities, and the residents of zero-vehicle households, by which we mean people who live in a household where they have limited access or inconsistent access to a private vehicle. The mobility gap demand assessment takes a similar approach, but focuses a little bit more on just the residents of the zero-vehicle households and does a comparison of actual kind of travel behavior and trip demand, essentially comparing the difference in trips taken between those residents in zero-vehicle households and their peers or neighbors in one-vehicle households, essentially the difference in travel behavior that emerges between those who don't have access or don't have reliable access to a vehicle and those who do. This data that we're referencing is taken from the American Community Survey, which is produced on an annual basis by the US Census Bureau. However, because it takes time to kind of process the data once it's collected and clean it up and make it ready for consumption, The most recent data that we had available when we started this analysis was the 2019 data. So that forms our base year. And this data is combined with the 2019 data that transit providers in the region submitted to the National Transit Database, so that we've got a kind of clear year-to-year comparison. We also estimate future demand for rural transit within the region using a horizon year or long-run projection year of 2050. And this 2050 horizon year is used as the basis to estimate future population and future demographics within the communities. And those projections are taken from the Governor's Office of Planning and Budget, which produces county level population projections from 2020 through 2065. So again, a kind of good combination of federal data and state data that forms the basis of this. What we find when we run these numbers is that in 2019, the non-program demand assessment yields an estimated rural transit trip demand for all counties in the region of about 139,000. The mobility gap demand assessment yields an estimated rural transit trip demand of 738,000. Now, that's providing a pretty wide range, and I apologize, I should have clarified that the non-program demand and the mobility gap demand are specifically chosen to give us a kind of minimum and maximum, respectively, of that transit demand to help kind of inform a range or spectrum of potential demand. Now, we compare those two rural trip demand estimates against the total number of transit riders or transit trips provided in 2019 by all transit providers within the region, which was about 348,000. Now that's really impressive. That's a great level of service provided. And what we see is that when we calculate the unmet rural trip demand, that existing level of rural trips provided exceeds the non-program demand level by quite a bit. So essentially, these the systems as they currently exist are meeting and exceeding that minimum level of non-program demand. However, they only cover a little less than 50% of the estimated rural trip demand under the mobility gap demand assessment. There we have an unmet rural transit trip demand of about 390,000. In the final row in this table, we estimate the total annual costs of meeting 100% of that demand. So that's both capital and operating costs on an annual basis to meet all of that demand. What we see is that the non-program demand total annual costs are about 2.7 million, whereas the mobility gap demand costs of meeting, again, all 738,000 trips is about 15.5 million. Now, we recognize that higher number might seem like a lot, and this is kind of by design. What this total annual cost estimate is a maximalist approach to estimating demand so that we can understand what level of resources would be necessary to serve everyone successfully. This is not a recommendation. It's not the number we're moving forward with. It's just the number that helps us understand that demand. Now, when turning to 2050, we see that estimated rural transit demand decreases slightly under both the non-program demand and mobility gap demand assessment. This is due in part to a decline in population in the rural parts of this region. So as a result, we see estimated rural transit trip demand decrease from about 139,000 to 132,000 under the non-program demand assessment, and decrease from 738,000 to 697,000 under the mobility gap demand assessment. So there's still a pretty robust demand for transit in both the current timeframe and the future timeframe. And the total annual costs of meeting 100% of that demand in 2050 increases slightly despite the decline in population. where those total annual costs increased to about $3 million in 2050 under the non-program demand assessment, and they increased to $16 million under the mobility gap demand assessment. That cost increase is attributable to the need to replace like vehicles on an ongoing basis as they age out and are no longer able to provide service. We'll move on to the next slide, where we take a look at the other quantitative assessment of transit demand that is included in this methodology. It's a little bit different from the previous two. This is the commuter transit demand assessment. And what this captures is essentially the travel patterns that occur between counties, essentially recognizing that there are these economic relationships between counties where one county may have a larger residential population and another county is more of a kind of center of jobs and economic activity. And as a result, there's travel between those two counties in order for people to go from their home to their jobs. And again, this kind of stands in contrast to the other two methods, which focused more on estimating transit demand for travel internal to the county and travel to meet a wider array of needs, like not just getting to work, but getting to doctor's appointments or going to school or running errands and going shopping. So this is just another way to analyze a different type of transit demand. And what we see here is that the kind of main activity here we see is between Lee and Dougherty County. Now, what I should clarify here that this is essentially the largest source of demand within this region. We recognize that every county has its kind of has its relationships with other counties that are going to produce cross-county travel, both back and forth, in the same way that people live in Lee and work in Dougherty. We know that there are people who work in Dougherty, live in Dougherty but work in Lee. But what we do for this is we set a minimum threshold value of 100,000 trips per year to sort of set a threshold of demand at which the costs of running that commuter transit service can be justified. And to clarify how these numbers came together, we actually use a proxy estimate of commuter transit demand to conduct this analysis. So specifically, we base commuter transit demand on a share of home-based work trips, as in people who work from home. These home-based work trips represent a proxy estimate because they represent work trips that are not being met by another form of transportation. So you can sort of visualize this as saying, someone who works from home may want to work in an office, and they've been working from home because the commute is long or the commute is difficult. And now that there's a transit option, they decide that's what they want to use to get into the office. The data here is taken from a database from the US Census Bureau and analyzed with assistance from the GDOT travel demand model, which is a tool that GDOT uses on a statewide basis to measure travel behavior and analyze travel patterns between counties or within regions. So using that data, we calculate an annual commuter transit demand of about 200,000 trips between Lee and Dougherty County. And in 2050, this number actually increases to around 374,000 trips. So again, even though we saw, regional population declines in rural areas on the previous slide, on this slide, we see, pretty robust transit demand that's going to increase into the future, again, because of increased economic activity and growth within Lee and Dougherty counties. So I will pause there for a second because that concludes the quantitative component of this, and just see if there are any questions, any feedback, need for clarification, anything like that.
Thanks, Barry. Yeah, what questions do you have about these numbers? Maybe the mobility assessment within the region that deals with trips within the county, or maybe some of these commute trips. Everything makes sense and kind of in line with what you are observing and feeling in this area? I wish I could see people's faces if they're nodding their heads. Okay, well, if you do have questions on it, again, there's still time to ask those. Chat box, raise your hand. If you think of a question, go ahead and raise your hand. We'll hold it until we're done with the presentation, and then we'll get to you. So don't feel bad about your hand being raised for a few minutes. So Baird, let's go into the qualitative and let's see what we're hearing from our other
We got
providers.
Suzanne, I'm sorry for interrupting really quickly.
You're good.
Suzanne says, yes, the numbers make sense to me.
Great.
Great. We are glad to hear that. So thank you. Yeah, we'll move into our qualitative feedback on the needs assessment, which captures the input that we've heard on our provider survey and rider surveys that Matt mentioned earlier. So these are the surveys that we've sent directly to our stakeholders in order to get a little bit more nuance on needs, priorities, and challenges for transit throughout Georgia. Essentially, this is an effort to get the actual perspective of those who both operate and administer the service, as well as those who use the service or who may use the service. And we're really pleased with the results we've seen so far. We've gotten a lot of very thought-provoking responses. So to start with the provider survey, we've received 36 responses to date. We're very pleased with this level of response. If you've taken the survey, thank you very much. If you haven't, the survey is still open through the end of the month, and we encourage you to take it. And in both cases, we encourage you to share the survey with your peers and colleagues. We really want to hear from as many people as possible. But diving right in, what we heard was that slightly fewer than 50% of respondents are able to carry riders to destinations outside of their jurisdictional boundaries, and about 2/3 of respondents have not pursued coordinated human services transportation or regional transit service. This is consistent with what we hear. Coordinated service takes a lot to operate. It requires a lot of administrative responsibility, and a lot of these service providers are smaller. We really commend the Southwest Georgia region for what they've done with standing up this service, because it's not easy. Many agencies reported less ridership in 2020 than in 2019. 6 respondents indicated that they had fewer than 5,000 trips in 2019, but this had increased to 10 respondents for 2020. Again, not surprised to see this. Obviously, with the impacts of COVID-19, we had a lot of different disruptions in transit service provision, with people losing their jobs, or hospitals stopping the provision of non-essential medical treatments, or restaurants closing down. We just had a lot of people who weren't able to travel to as many places as they could previously in 2019. And of course, tragically, there was also the loss of life that occurred. So as a result, some of these agencies may have just lost a portion of their ridership base. So we're trying to be cognizant of that, the fact that a lot of these transit agencies are essentially in a rebuilding phase as they come out of the pandemic, and trying to recover ridership as they look forward. We did ask agencies to indicate what sort of technologies they currently use or are anticipating using. And the most interesting finding here was that while only 2 respondents indicate that they currently use a smartphone app or a website for trip planning and fare payment, 8 agencies are considering adopting this tool. So that's great to see that obviously, these sorts of technology-based solutions have made a lot of improvements and created a lot of value for riders, just giving them more ways to access service and use that service. So we're glad to see the technology-centered approach to planning for the future. We asked also about the most common challenges for state of good repair needs, and heard an interesting mix of kind of traditional issues, but also some issues that suggest, again, the impacts of COVID still being felt within the industry. So the most common state of good repair need is purchasing new vehicles. Again, a perennial challenge of rural and human service transportation providers is ensuring that you can secure the funding and execute the procurements to get those vehicles that you need to maintain your service. But the other most significant challenge in this area was a little bit newer to us. It was establishing regular maintenance schedules for vehicle maintenance. Essentially what this was, our respondents explained to us that they share maintenance staff with other providers in their region or with other county governments or municipal governments in their region. And as a result, the maintenance staff literally have to rotate through, and providers can't complete their maintenance exactly when they want to, but instead when the maintenance workers become available.
Hey, Barrett.
Yes.
I want to just interrupt you really quickly because we
No,
did
please.
get some comments via chat. One saying that Jeff Hamilton says, yes, this is consistent with our region. But Catherine says that she just wanted you to know that she's with vocational rehabilitation and that they do not provide trips. The survey would not be applicable. And she said, sorry. Just wanted to put that out really quickly.
No, thank you for that additional context. That's very helpful. I would say in that case, if you have relationships with those providers that do, we would encourage you to share it with them. But obviously, your perspective as someone who interacts with these service providers is still really valuable for us because we want to hear that kind of user perspective. Continuing on these challenges, the scheduling of maintenance workers overlaps with some additional findings that we got. Namely, we asked about the most significant challenges that providers are experiencing in the administrative area, the rider demand and satisfaction area, and the funding area. Within the administrative challenges, we heard compliance with state and federal reporting, again, a perennial issue for these smaller providers. We know that, doing the reporting takes a lot of time, and you've got a small administrative staff to execute it. But the other administrative challenge was attracting and retaining qualified personnel, which again sounds like an issue emerging in the post-COVID era. In a workshop that we held last week, we heard one provider say that they've been losing drivers, and not to other transit providers in the region or other, like limousine companies or charter bus companies, things that, provide transportation services, but rather these drivers were leaving the transportation sector and working in fast food. The fast food restaurants have had trouble keeping their workforce as well. And so they're raising their wages, and they're able to pull people out of the transportation industry entirely. And, they're going to go flip burgers and serve fries. And it just speaks to the scope of this challenge, that transit providers are competing with pretty much everyone to secure their labor force. So we're definitely sensitive to the scope of that challenge. Within rider demand and satisfaction, the most significant challenges that we heard were expanding service into new markets, which again, the classic challenge of responding to customer needs and making sure that transit goes to where they need to go, but then also dealing with the public perception of transit, which is a mix of, more traditional issues where people see transit and they think it's not for them. They think it's for people with disabilities or the elderly, but they don't necessarily recognize the value that transit can play in their own lives. And so we have the issue of, marketing and outreach. But we're also dealing, again, with, transit in the era of COVID, where people assume that, or are concerned that transit vehicles are not safe spaces, that, being in an enclosed space close to other people exposes them to health risks. The evidence suggests that that isn't the case, but again, that's a perception that we need to overcome as part of, the marketing and outreach for rural and human services transportation. And then finally, the most significant funding challenge that we heard was securing local capital funding for those new vehicles. Again, a perennial challenge, recognizing that a lot of these rural and human service transportation providers operate in small counties that, you know, have pretty lean operations and small government budgets. And so finding the money for those kind of long-term investments can be difficult. So definitely a lot for us to think about as we start preparing our recommendations and strategies. Moving to the rider survey, we've received 55 responses to date, which again, we're very pleased with. We're glad to have this level of engagement, but again, the survey is still open, so we encourage you to share it with your constituents as well. What we've seen so far is that 85% of the respondents to the survey do not currently ride transit. We're glad to see that level of engagement and participation from people who do not ride transit. We want to be able to understand what they see as the barriers to using transit or why they think they might not want to use transit. But we also want to make sure that we're hearing from our riders as well to ensure that we are able to continue providing a meaningful and high quality level of transit service for them. And so ultimately, we do hope to get that closer to a 50-50 split. Among those who ride transit, their main reason for using transit is that they lack access to a vehicle, and their most common trip purposes are work, medical appointments, and dialysis appointments. And what we see in those responses are things that we'll keep seeing throughout the responses to the survey, which is that you're talking about time-sensitive trips that people need to be at a very certain time. We all need to get to work on time. We need to get to our doctor's appointments on time. Dialysis appointments are scheduled very tightly, and so you're working with a time-sensitive environment for travel. If transit were not available and riders had to find an alternative, their most common response was that they would get a ride from a friend or a family member. Again, very common to see in rural transit. We recognize that people are often kind of meeting their mobility needs with a combination of transit and rides from within their social network. But recognizing that relying on that social network isn't always consistent, it isn't always easy, and it creates a cost for those friends and family members who then have to provide those trips. We want to ensure that transit is a robust part of their mobility options, and that they are able to use transit for as many different trip purposes as they can. Among those who do not ride transit, their two most common reasons for doing so are that they are interested but transit is not convenient, or unfortunately that they are not interested, which again may speak to that public perception issue and speak to the need of doing the marketing and outreach to help people understand where transit goes within their communities, how they can use it, and what sort of benefit it can provide to them. Among those who do ride transit, their most frequently selected challenges for using rural and human services transit is that it is not reliable enough to use for time-sensitive trips, again, like work and healthcare appointments, or that transit does not go to where they want to go, or the distance to the nearest transit service is too far. So that starts to speak to some of those first mile, last mile gaps within the transit network, and to the larger issue of transit service coverage within these regions. We asked respondents to indicate what sort of transit improvements they want to see transit providers prioritize. And again, pretty clear responses that speak to the challenge of rural and human services transit, where they want to ensure that they have access to jobs and to healthcare, but they also want to connect different parts of the community or region. So we see both the coverage challenge of making sure transit goes to all the different places people need to go, but then also the reliability or the responsiveness of getting on transit and being able to complete that trip quickly so that you reach that your job or your doctor's appointment in a timely manner. We also asked rider respondents to indicate the most important transit technologies for these providers to prioritize. And here again, what we hear is real-time arrival information at transit stops and real-time arrival information via smartphone, website, or text. So the riders really want they want to be able to hear from their transit providers. They want to be able to see where their trips are and when those trips are arriving. So again, they can plan accordingly and ensure that their transit service will be reliable and consistent for meeting some of those time-sensitive needs. So that is the full set of responses that we've had to date. Again, just want to stress these both surveys are still open. We encourage you to take them, encourage you to share them with your peers, colleagues, and constituents.
Thanks, Baird. So that that concludes the presentation portion of the workshop. We want to use the remaining time to kind of hear from you. I want to first just reiterate how much we want to hear from you. This is really going to influence the projects and programs and policies that we develop as a part of the recommendations. And we want to make sure that we're coming up with solutions that address your problems. And so while having the survey and the quantitative data is great, hearing from you all what your firsthand experience is, or maybe what your customers' experience is if you're not a provider, what you're dealing with. We heard comments like, I've got medical patients. I'm a nurse and I've got medical patients who need specialized care. We don't offer specialized care in this region. They have to go up to Atlanta to get that care. But we're having a really hard time finding providers who provide those long distance trips. And when we do, because of shortage of labor or whatever it is, those providers are actually canceling the trips on my patients and they're not able to make it to their medical appointments. Like, those are real problems that we really want to try to find some sort of solution or a program or something to help improve transportation across the entire state. So just as a reminder, if you are on the Teams app with us, you can use your raise hand feature, enter questions and comments into the comment box. If you are on the phone, please feel free to unmute yourself and just kind of speak up. Don't worry about interrupting me. And we have some questions for you to kind of get your thinking going. We talked about existing service and constraints on those existing services. But what about your service areas and different connections? Are there missing connections? Are there other areas that you're trying to get to that you just can't? Are you finding a demand for services, maybe outside of the state? I don't know, in some of the other regions, people travel up to Atlanta for some of the services, but for you all in Southwest Atlanta, maybe you're seeing a lot of more demand going down to Tallahassee for services. Or, maybe you're trying to go east over to Valdosta for services. So are there any connections that are missing or where you would like to see some enhanced service? So that's kind of the first question. I'll let you think about it. I'm going to continue kind of talking while you think about it. And until you raise your hand and put your comments in the comment box, I'll just continue to talk. What are some other needs that we haven't identified? Maybe some service areas. We talked about workforce programs. I think that constitutes as a need that we haven't identified.
And we have one from Jamie who says, clients trying to cancel early trips or weekend trips is an issue with offices closed during this time. So yes, rides to Tallahassee or Dothan for medical appointments.
Dothan, yep, Dothan. We go through Dothan.
Thank you, Jamie.
Thank you, Jamie. Yeah, so you have customers canceling early morning and weekend trips and calling in to cancel those while your offices are closed and nobody's taking those calls. So maybe they're not getting the information soon enough about that cancellation. That's tough.
And then there's another one from Catherine who says no out-of-state travel is needed.
Okay. Am I understanding correctly that when you say no out-of-state travel is needed, that most of the services that your customers require are available either in your region or an adjacent region in Georgia. Yes.
Okay, hold on. So they're coming in. Yeah, they're coming in really quickly. So
Great.
let me do 1, 2. So Jamie says yes, and then we are charged for no shows. Then Melissa says, I am speaking on behalf of a relative in Colquitt County who has no car and who has asked, can transit vehicles come down very isolated, poor quality dirt roads? Again, that's poor quality dirt roads with driveways that do not go up to doorsteps like a farmhouse type building. Can transit serve them? Then we have Jeff, who says workforce needs is an issue, as well as student learners, i.e. high school seniors, for technical college classes. Then Suzanne says Thomas County has a great transit service, but they typically only provide trips that's within the county.
Okay, man, great comments. Great comments. Okay. So let's break it down. So when we have a rider who has no car, who lives in an isolated area down a dirt road, that doesn't have much of a driveway, like a farmhouse type building, can transit serve them? I'm inclined to say yes. However, I do not want to speak on behalf of transit providers in this area. So if there is somebody on the line that provides some transportation services, or maybe somebody from the regional commission, maybe you have a better answer for that question.
Then I want to add really quickly, Kirsten, that Suzanne says, oh no, let me go back. That was right. I was right. Jamie says, I saw where Valdosta was trying out some smaller vans for a few riders. Could this be done in Albany? Then followed up by Suzanne saying, speaking on behalf of the SWGRC Transit, we will provide service as long as we can get to the residences.
Okay, so if it's off a dirt road, then it sounds like yes, the vehicles can get there. Okay, let me go back up to the workforce needs. I think this is a comment that keeps coming up over and over, and I'm really excited to hear that perhaps there needs to be a program created or something to address the workforce needs, not just for those that are in the workforce, but as the comments suggest, student learners, high school seniors, technical college students who have apprenticeships or internships, who are trying to get that work experience, and they're going to be going out into the workforce as soon as they graduate high school. Giving them the transportation and the opportunity to be successful from the start, I think we can all agree is an incredibly important for the economic success of these regions, and making sure that residents are employed and have the proper transportation. So we've heard that across several regions now, and it's becoming one of the prominent comments that we're getting. So thank you. Suzanne, Thomas County having great transit service and can only provide trips within the county. Do you know if that stipulation on them not being able to go outside their jurisdiction is their county commissioner's decision? Like basically we have the services in this county, and so we don't want to provide trips outside of the county, or what's the barrier to them providing more trips outside the county, or even joining your Southwest Georgia transit service?
Let me also interject where Suzanne has said smaller vans have been available through the GDOT contract. We have at least one Ford Transit van. Then she says, yes, that is the decision the county made.
Okay, so I think that there are some political barriers in place across the state. Their county commissions understand that these transportation services, if they're going to provide them, they want it to support the services that they have in their county, and that's understandable, right? They want to keep people in their county to boost their economy, support their businesses. Um, but it is a barrier to coordination. And so perhaps there needs to be more educational materials or just more education in general to state leadership and county leadership as to the benefits of coordination and maybe even demonstrating the economic benefits of it as well. So thank you. Talking about vehicles, smaller vehicles, one of our goals is right sizing fleets. Making sure that transit providers have the right type of vehicles for the services that they want to provide. As Baird mentioned, with some of the trends post-COVID, ridership has declined. We hope it all goes back up, but it has declined with more of these flexible services, micro transit, mobility on demand, flex routes. You know, the larger cutaways may not be the most appropriate for that flexible service, and maybe some smaller vehicles are, and maybe those smaller vehicles are easier to acquire. Um, I think you know the vehicle shortage, the supply chain issues, has really had an impact, and I'm curious to hear if that's really been an impact for y'all too, from getting new vehicles or getting parts for your vehicles and getting them back on the road.
Let me say this too, Kirsten. Suzanne says that they have 20 passenger vans parked because they cannot find CDL drivers.
Yeah. Yep. And that's exactly what Baird was talking about with driver shortages and being able to pay competitive wages. Do you feel if you could increase your labor wages that you would be able to attract more CDL drivers or attract people and then be able to help them obtain a CDL license? I'll give you a minute to answer that. I'm gonna move forward with some additional questions, and this is about the coordinated service. So keep the comments coming. We can talk about anything and everything that you guys want. These are just some things to get you thinking. But you guys do have a pretty large coordinated system in Southwest Georgia, and I want to commend you on that achievement because I know it took a lot of work. And thinking about the process of going through that coordination and getting this jump started and getting counties on board with this idea of coordination, do you have some lessons learned or things that you want other regions to know about starting a coordinated service, maybe some challenges that you really had to overcome? Did it take longer than you thought it was going to? Why did it take longer? Um, what were your barriers to get this model up and running? So I want to give that a minute.
Suzanne says that we are encouraging our transit operators to provide CDL training.
Okay. Yeah, and maybe there's a program statewide that we could look at for CDL training. I know GDOT provides training annually. And so maybe there's an opportunity to expand that. I'm just throwing out ideas. These are all things that we want to kind of think about for recommendations. Is your coordinated system working well? Are you finding that you're able to provide trips? I saw somebody made a comment that during the day, DHS riders are taking up most of the capacity on vehicles, which is limiting the space for public transit riders. I'm also curious, like the types of trips that you're making. Are they long distance? And with this area being very large geographically and quite rural, is it difficult to meet, the trip demand and make those longer trips?
Jamie's saying that she thinks that we are seeing more demand for buses with wheelchair lifts for elderly dialysis patients. That's from Jamie Harper.
Okay, thank you. Yeah, and to balance that, you know, those
And then Jordan says, to build upon what Jamie says, she says that my aunt there would need a wheelchair lift to use transit.
yeah, okay. Yeah, so Melissa, I highly suggest that you go to the Southwest Georgia Regional Transit Service website, and I think Suzanne can provide you a link in the chat. And you can get some phone numbers to start finding out which service is best suited for your family.
That's great, because Suzanne says most of the fleet, 76 vehicles, are ADA accessible, and Melissa says she's going to do that.
Okay, that's fantastic, Suzanne. I mean, 76 vehicles that are ADA accessible is quite successful. I don't know how long it took you to get to that size fleet with those being ADA, but I know that's a real tough balance, and especially now because most of those vehicles are custom. So not only do you have to get the vehicle here, you also have to get it modified to add the wheelchair lift. These are great. Keep them coming. Okay.
Yes, she says 76 vehicle total. Most, not all, are ADA accessible.
That's still fantastic.
Still good. Impressive.
Yeah.
Yeah.
So I have some other questions, and like I said, keep them coming. Keep the comments coming. Keep the questions coming. But these are more on the administrative side, and some other needs that perhaps you're struggling with. We talked about some of the training needs, CDL licenses, labor shortages. Are there other operating or administrative needs that you have? You know, I heard the comment that people are canceling early morning and weekend trips, and they're calling in and canceling those when nobody is there. One of the regions, their suggestion for a solution was to have be able to have an automated answering service. And maybe for cancellations, there could be a special after hours number that is called. I know nobody likes to be on call nights and weekends, but maybe a program to help support that could be an option.
Suzanne says that their barriers have been limited funding for DHS services.
Yep. Funding is definitely a major barrier. One of the regions we talked to yesterday, they said that, you know, they're holding on by strings, shoelaces, to keep their service together from a funding perspective. And so maybe there's some more, you know, we've got this new infrastructure bill coming down. Guidance is expected to come over the next several months. I've looked at some of the programs, but I think as a part of this, let's look at some of the programs coming out of that and see if, you know, these types of solutions are eligible for those funding sources, and maybe there's some more leveraging opportunity coming. And then kind of one final question, kind of pie in the sky, but this will really help us understand how you all feel money should be prioritized. If you had $1 million just given to you, how would you spend it? Where would you put that money?
Suzanne says 5311 funding requires 50% local match.
And that's really tough. You know, Baird mentioned in his survey that one of the biggest financial challenges was coming up with that local match commitment. So perhaps, and I'm not saying this is a solution for everyone, but going back to the workforce, and I'm just kind of thinking through what would love to get your thoughts on some solutions. Perhaps there's some public-private partnership opportunities with employers, with the university system of Georgia, with the technical colleges across the state, to implement some sort of program to leverage that 5311.
And then Jamie says the RC coordinated transportation system has done a great job working with us concerning meal deliveries during the pandemic.
That's great. Thanks, Jamie. Yeah, that's something else that we've heard. It was in the Atlanta region, is that during the pandemic, these vehicles were used for meal delivery to seniors at their homes. Now that senior centers are opening back up, you know, the transportation providers are going back to servicing people rather than meals. But there's still a struggle with that balance, like with the Omicron variant, the Delta variant, this new, I heard the term stealth Omicron yesterday on the news. Um, are you finding that you're still needing to deliver meals and provide transportation to people? Or have you completely transitioned back to just transporting people? I'm gonna give that another minute. And also, if you want to answer the question, if you had $1 million, how would you spend it? Let us know. Where would you prioritize that money? Maybe there's a program you've been thinking about. Maybe it's just paying your drivers more. Maybe it's just purchasing new vehicles or putting wheelchair lifts on your vehicles. And I just want to say, really appreciate all of the comments today. Matt's going to tell you a little bit more about how you can continue to provide your questions and comments.
And right
Yeah.
before Matt does that, let me say this really quickly. Jamie says that we operate under the new senior center without walls model, and will soon start transporting clients to and from our restaurant providers instead of delivering those meals.
Okay, that's great. I have not heard about that model, so I have written it down. I'm going to do a little research. Thank you.
Jeff says salary and incentive would be great.
Okay.
And then Jordan says, that's fantastic because it would help reduce isolation of seniors. Debbie says, from the provider's view, the rising cost of vehicle insurance is a major issue, as well as the fuel and salaries.
Okay. Y'all, thank you for being so active in the chat. This is great. This is really helpful. We're gonna jot all these things down, compile them. We're gonna go through them one by one and be like, okay, how can we address this? What are some ideas for addressing this? What have other places across the nation that have done that, have tried to tackle, this particular issue? So these are great, and you're gonna see them in the documentation. So Matt, I'm gonna turn it back over to you to wrap us up with a couple slides, and then we'll take any final questions or comments you may have.
Awesome. Thank you so much, Kirsten. And thank you all again for being so engaged this afternoon. This is really important feedback we need. It all goes into the documents and goes into our existing conditions, which we're working on. So again, thank you all so much. Just to review our schedule one more time, again, we're wrapping up the existing conditions. This information will go into this assessment and also the alternatives analysis. And we will start developing the draft final report in the coming months. We're targeting July for publishing the draft final report, and it will be on our website for that 30-day public comment period. Once again, I want to say thank you so much for your participation in today's workshop. Please don't hesitate to reach out to me or to Kirsten with any questions or comments on the information we've shared today. Also, we ask that you please complete the survey if you've not done so, whether you are a provider of RHST services or a rider on those services. We want to hear from you. If you're on the phone, you can find the surveys at www.dot.ga.gov/transit. And my email is mawilson@dot.ga.gov. We do ask that you send any questions or comments by March 4th, so we have time to respond. With that, again, I want to thank you for the time this afternoon and for all the information you shared. It's been really fantastic, and hope you have a great day. Thank you so much.